This video demonstrates endovenous ablation. We shot this in our Billings, Montana location, and it demonstrates two patients having the procedure done. One patient has the endovenous laser treatment and the other has radiofrequency ablation. The first thing that we do is we have to map out the vein. The ultrasound technologist will identify the vein and put markings over the vein with a straw, and then connect the dots with a marker. This will demonstrate to me where the vein is and where I need to focus my attention. The leg then needs to be prepped. We do this procedure under a sterile technique, and we prep and drape the leg just like we do in the operating room, and this reduces the risk of infection. I have to survey the vein with the ultrasound to understand the anatomy of the vein and how I'm going to treat it. Once I have chosen the appropriate access site, I have to numb up the skin over that area so I can place a needle through the skin. This is really the only part of the procedure that's uncomfortable, and it lasts for about 5 seconds when I numb the skin up. Once we get this numbing medicine in, I place a needle through the numb area into the vein, and I use the ultrasound to help guide where the needle goes. You can see from the video, when we look at the ultrasound, the vein shows up as a long black tube, and you can see the needle moving in the upper right hand portion of that video, and that's the needle actually going into the vein. So everything that I do is guided with ultrasound. Once the needle is in, I place a little guide wire through the needle into the vein, and this allows me to thread the catheter, which you see right here, over the guide wire into the vein. This is the one we use for the radiofrequency ablation, and this is actually the laser fiber that we use, and the radiofrequency catheter is demonstrated here. I'm actually placing it into the vein and passing it up to the top of the thigh where this vein originates. What you don't see is the ultrasound technologist holding the probe over the leg and guiding the catheter up into the vein. So everything we do with this procedure is guided with ultrasound. This is what it looks like once we get everything set, ready to go. Before I treat it though, I need to numb up the vein so it doesn't hurt when we treat. Most people will tell me that this part of the procedure, they feel a tight pressure sensation. You can see by the patient that she's not grimacing or having a bad time here, but we have to put this fluid all the way around the vein from the access site up to the groin so that you don't feel it when we treat it. The video here actually demonstrates me treating the vein with radiofrequency ablation. I'm activating the catheter with the white button on the handle, and we treat for 20 seconds at a time, and I hold pressure on your leg and you don't feel anything, and then we move the catheter back 7 centimeters and treat again, and we repeat this sequence until the entire vein is treated. So it's not very exciting part of the procedure, but it's very easily tolerated. Even though this patient's having radiofrequency ablation, the experience that the patient has is exactly the same when I use the endovenous laser. This picture shows what we call a completion ultrasound. It demonstrates that the vein is closed and that the deep vein system is functioning properly and doesn't have a problem. Once we're done, we have to clean up all that soap off of your leg, and this is the entrance site, so it just needs a little band-aid. And then lastly, we put the stocking on and put it in the appropriate spot so you don't have any wrinkles or creases to cause discomfort, and let the patient get up and walk on the treadmill, or if that doesn't work for you, then you can walk in the halls. But walking reduces your risk for blood clots afterwards and makes your legs feel better. So you can see that the procedure itself is very well tolerated. There's not a lot of pain associated with it, and most patients are very happy with the results.